You're listening to Planet Vero Radio. I am Cindy Schwartz, and this is the Patient Partners Show. We are broadcast on iHeartMedia, on 101.7 FM Real Radio, WCZR, and also podcast on Spreaker and all the platforms that Spreaker allows that we have, iHeart platforms, all of those. I'm talking with Jeannie Roller, my co-host today. We are talking about a bill that I found doing a little bit of research online, and it is a Senate Bill 1993, and it was introduced on June 26th of 2019, so pre-COVID, 6 months before COVID, and it has to deal with patient rights. So the title of the bill is Patient Rights Act, and I believe people have heard about this, read about it, and we're doing some research. I am doing some research on where exactly this bill is, what's happened to it. Has it gone by the wayside since COVID and all of the entities that have happened with COVID, the things that we've heard, media prevalent things, that the healthcare workers are overworked, they're underpaid, they're short-staffed, they're abused, their patients are giving them a hard time. It's just, mind-boggling, some of the things that have happened to some healthcare workers, and there's also a bill that's championed to help them. But I want to read a few things, Jeannie Roller. Humor me here, because I just find it amazing that a bill like this, it was sponsored by North Dakota Senator Kramer, and then also co-sponsored by Montana Senator Daines, co-sponsored by Tennessee Senator Blackburn, and then Mississippi Senator Wicker came on board a few weeks later, and this is all in 2019, to follow the bill, again, called Patient Rights Act. And it says the verbiage in a lot of this are things that we talk about on this podcast all the time. And key points to that: restriction on federal funding for healthcare entities that do not respect all human life and patient rights. In general, it says that if you, as the doctor working for that establishment, and the establishments are all going to be held accountable, and it goes on to name, you have to exercise the same degree of professional skill and care and diligence to preserve the life and health of any patient, as a reasonably diligent and conscientious healthcare practitioner would, and it includes unborn, newly born prematurely, pregnant, elderly, mentally or physically disabled, terminally ill, in a persistent vegetative state, unresponsive or comatose, or the key one that I want to light on is what we talk about all the time, otherwise incapable of self-advocacy. Right. So there's your surgery patients. There's your people that are under the drugs and all of those things, under the effect of so many things where you can't advocate for yourself. And it goes on to say that the solutions would be a public database. So it shall be established and maintain a public online searchable database of the entities subject to this section, indicating whether each such entity is in compliance with the requirements that I've talked about, and also enforcement. So any entity found to violate the requirements of the section shall be ineligible for funding described in such subsections for a period of at least 1 year. And then it also goes on to say that the secretary, The secretary then can put into effect that the Department of Justice, as well as the person, can bring civil litigation against these people that are doing these harms and these, atrocities, whatever you want to label it, against patients. So, what are your thoughts on it, Jeannie? We've had a conversation before we went on air about this, where is it going to pass? Is COVID now making this go away? What's going on with this? Because you don't hear about it. It's been, 3 years.
Right. Well, I have a lot to say about it. I mean, it sounds good, but when you get to the nitty-gritty, who is actually going to decide if a hospital has violated any of these laws within this bill? I mean, that's the trouble that we have now. We have rights, we have laws that are supposed to protect us, but we have no one who will enforce them the way that they should be enforced. There's always a loophole for them to get out of it. That concerns me. We currently have a bill in Congress, I think it was passed by the House, to protect healthcare workers from patients. That one will probably be passed because there's been several instances of patients who have had issues with healthcare workers becoming violent. I know one story that a couple of doctors were killed by a disgruntled patient. But I don't see something protecting patients having the same strength, because medical lobbying is strong in Washington. There's a lot of money. There's a lot of power there. So things to protect the patients generally don't pan out, like informed consent laws that are supposed to protect patients. They don't protect patients.
The one thing that I find amazing about this is this verbiage that's in this bill is almost exactly verbatim of what we talk about on this podcast continually.
Right.
So is it then, since this is actually written in a bill, then being said, we know about this? That's the way I'm looking at it. So if you're writing in a bill, Senator Kramer, Senator Daines, Senator Blackburn, Senator Wicker, then do you know about this stuff going on? Because you're standing behind it in a bill, you're putting your name on the bill, but yet nothing's being done about it, but yet you're saying that we're going to come up with a bill because we know this stuff is happening.
Well, and I think it comes more or less from dealing with Medicare, because we know there is abuse of Medicare patients, and that probably is where the verbiage is coming from. However, though, when you file a complaint with Medicare, usually nothing comes of it. At least it didn't in our case. They just said he should just be glad to be alive. So, I mean, yeah, it all sounds great, but when it comes down to it, it still leaves patients unprotected, is what I think will happen, because who's going to be deciding if something is a violation? So,
But if you're putting your name on a piece of paper on a bill, I mean, anyone can read this. This is public knowledge, right, if you know where to look it up. If you're putting your name on a piece of legislation that knowingly says that this is what's going to happen, so I'm thinking that you've done your homework. Someone should, at least do some homework on it, right? Where are they? You're saying they're probably getting their information from Medicare.
Medicare, yeah.
Okay, so that's kind of the benchmark of what everyone's supposed to be held accountable to. Those somebody's got to have the benchmark of something. They do. So how then, and this is a rhetorical question maybe, I don't know, how then has this been dropped because you're admitting that patients are being harmed? So did they just automatically stop being harmed when COVID came along?
Well, I don't know if they're admitting that patients are being harmed as much as it is the same language in Medicare, where they also have the same situation. Patients are being harmed, but patients get no justice for being harmed, even though there are laws that Medicare has, and they have the procedure to file complaints, they have the investigations, and then nothing happens. I mean, for the most part, nothing will happen. So yeah, you put your name on a bill. They have bill writers for these people. So yeah, I just don't have much hope that anything real will be done. And yeah, probably because of COVID, it will not ever get out of the committee that it's in. It will just die there, because COVID has made healthcare workers heroes, and now these heroes are being harmed every once in a while by harmed patients.
But on the other side to it, we've brought in cases, too, that have been litigated after COVID or during COVID that show that healthcare workers have harmed patients.
Right. And we know that. And we know that probably occurs more often than patients harming healthcare workers. I mean, that bill that's currently in Congress to protect healthcare workers says that they want to protect it from patients intimidating a healthcare worker. Well, they didn't, as far as I could see, define intimidation. Is that intimidation when you say, doctor, do you really need to do it this way? Is that intimidation? When you ask questions, when you say, I don't want to be naked, I don't want female care, I don't want male care, is that intimidation?
Well, I'm going to say you've been listening to another episode on Patient Partners. Please stay tuned to Planet Vero Radio.